Okay, well, hello, everyone. My name is Peter Clark. I'm with Senator Shaheen's office here in New Hampshire. Thanks for joining us today as we have this important conversation about the Affordable Care Act. Before we get started, just a few housekeeping notes. Please keep yourself on mute if you're not speaking so that we can avoid any background noise. Also, we are recording this conversation today, so you will see the record button in the top hand corner. Please let us know if you have any concerns with that. Before we get started today, and I turn it over to Senator Shaheen, I just wanted to go through a quick roll call to make sure we have all of our speakers on the line. Do we have Tiffany Fuller from the New Hampshire Insurance Department?
Yes.
Hi, Tiffany. Jeremy Smith from First Choice Services.
Yeah, I'm here.
Hi, Jeremy. Ed Shanshala from Amanuense Community Health. I see Ed there.
Here. Yep.
Hello, Ed. Do we have Dr. Marie Ramos from Gatehouse? I don't see her yet. Okay. Do we have Lisa Bodwin from Able New Hampshire? Yes. Hi, Lisa.
Hi, Lisa.
Do we have Pepper Mead?
It's Pepper Napo Mead, but that's me.
Pepper Napa Mead. Thank you.
You're welcome.
And we have Zan. I see Zandra Rice Hawkins on the line. Thanks so much. Okay, and then we just want to welcome some of the press that's on the line today with us. We have the Union Leader, the Caledonian Record, WMUR, NECN, NBC Boston, and the AP. So thank you all for joining us today. And with that, I will turn it over to Senator Shaheen.
Well, thanks very much, Peter. And I also on the call is Jeanne Shaheen. So Jeanne, thank you, and Zandra for helping to organize today's call. And thank you all so much for joining me in this conversation. In addition to Peter Clark from my office, we have Peter Feis, who is in Washington, who works on healthcare issues. And we also have Allie Priest, who is my scheduler, who's with me here in the Dover office, and Alan Rodriguez, who's with our communications team, who you see his picture. He's listening in, but I think he's not going to be Zooming with us today. But let me begin by, again, thanking all of you so much, not just for being on the call today, but for everything you've been doing to try and ensure that people in New Hampshire get healthcare coverage. We know this has been a critical time over the last year with the pandemic. We know there's been a lot of uncertainty under the Affordable Care Act. The good news is that back at the end of last year, during the open enrollment period, that New Hampshire numbers of people enrolled in the ACA actually increased by about 5%, which was very good news. And at the national level, there was a slight decrease, but not nearly as much as we thought there was going to be. And I think it's a function of people recognizing, as the result of the coronavirus and this pandemic, that healthcare coverage is absolutely essential. It's something that we all know. I know that all of you have been working hard on that, but it was a real wake-up call that we need to ensure that people can get health insurance when they need it and that it's affordable. So one of the things that I am doing today is introducing legislation to try and address costs under the Affordable Care Act. It's a bill that will expand tax credits to a broader universe of people who make up to 400% of the federal poverty level. It also increases the cost sharing payments that the insurance companies provide for co-pays and deductibles. So again, an effort to help people afford the cost, and it's tied, rather than the second lowest silver plan, it's tied to the second lowest gold plan. So that means the coverage is better for folks. I know that all of you are going to talk about the challenges that you're seeing out in the marketplace, and we can also talk about the COVID relief package, which is the reason, well, under the Biden administration, they have opened up this special enrollment period for the ACA, which will run through May, the beginning of May. But one of the things that the COVID relief package does also is try and provide expanded coverage for people during this pandemic. So we're happy to answer questions about that and to hear your thoughts, but I really want to hear from all of you this morning. So thank you very much again for being on. I look forward to hearing what you have to say, and I look forward to trying to answer any questions you might have and to working with you as we address the Affordable Care Act. And I realize as I'm saying this that the one thing I need to mention before I close is the uncertainty around what the Supreme Court is going to do with respect to the Affordable Care Act. We know we could see that decision anytime now, and it's not at all clear what's going to happen. I'm a little more hopeful based on how the oral arguments went that they won't totally strike down the law, but there's no predicting what they're going to do. So this is an especially critical time to ensure that we do everything possible to get people the health care coverage they need. So I will stop there and turn it back to Peter to call on folks.
Well, thank you, Senator. And we are going to start today with Tiffany Fuller from the New Hampshire Insurance Department.
Thank you. Good morning, everybody. And thank you for inviting the Insurance Department to participate in this very important topic. As you know, February 15th was the start of this new special enrollment period, which essentially allows New Hampshire residents who are uninsured another opportunity to sign up for health insurance through the marketplace. And this special enrollment period runs only through May 15th. So this timeframe is important to keep in mind because the opportunity to purchase health insurance on the marketplace likely won't open again until this fall. With that being said, there are a couple main points that we would like to have folks leave with. And one is in 2021, there are 3 insurance companies that will offer ACA compliant individual plans on the marketplace. And they are Anthem, Ambetter from New Hampshire Healthy Families, and Harvard Pilgrim Healthcare. Plans that are purchased during the special enrollment period will provide health insurance through 2021. The second point is one about exercising caution when exploring and purchasing health plans. Plans certainly can be purchased outside the federal marketplace through an insurance agent or directly from an insurance company, and they should cover the same essential services as marketplace plans. However, if a consumer chooses to purchase any plan other than the 3 offering ACA compliant plans, which are being offered on HealthCare.gov, which I mentioned earlier are Ambetter, Anthem, and Harvard Pilgrim, the insurance department just really strongly urges consumers to ask questions and exercise caution. If a consumer is unsure about the plan or the agent they're working with, they're encouraged to call the New Hampshire Insurance Department. There's no cost. And we can confirm if the agent or the company is legitimate and licensed in New Hampshire. So in closing, I will leave you all with some contact information and just urge, don't delay. As I mentioned, this is going to end May 15th, and you can go to HealthCare.gov to enroll. And if you wanted to contact the insurance department, we can be reached by phone or email. And toll-free number for you is 1-800-852-3416. And you can email us at consumerservices@ins.nh.gov. And thank you so much again for this opportunity to participate in this call.
Thanks, Tiffany.
Thank you, Tiffany. And we will be sure to put that contact information in the chat. So next, we're going to turn to Jeremy Smith from First Choice Services that provides navigating services to New Hampshire.
Thanks for having me today. So yeah, I'm the program director for the New Hampshire Navigator program. We've been doing that service for almost a couple years now. And we were just really excited to hear about the new open enrollment period that was announced by the Biden administration. You know, we was able to help a lot of people through the process during the first open enrollment period, but now this new opportunity, it's really going to make a big difference in people's lives. And if somebody's not familiar with our service, we're a free grant-funded program from CMS just to help people navigate all of the insurance options available to them. So what we do is we talk to you about the 3 carriers. We look at the prices, the deductibles, the co-pays, make sure your doctors are in network, make sure your medicines are going to be covered. And we really just work with each and every family and spend time with them to make sure they get all of their questions answered and make sure that they can sign up for the plan that they choose. So we assist with the sign up as well. So, you you know, it's a great program. It makes a big difference because I constantly hear that they're just very nervous about going at it alone and trying to pick that insurance plan that they're going to need to use for the rest of the year. So by working with one of our certified health insurance navigators, they can get that free assistance and make sure that they get signed up for a good insurance plan. And, you know, like I said, we were excited to hear about the new open enrollment opportunity. We've had a lot of people already reach out to us and take advantage of this new open enrollment period. And it's been kind of a mixed bag about what we're hearing from people. A lot of folks didn't know about the first open enrollment period. They just missed it. A lot was going on in their lives. You know, they were worried about other things and that they just missed that first opportunity. So now they're able to sign up on this new open enrollment period. And as Tiffany mentioned, that's going to go until May 15th. So that's been a really good opportunity for folks. And, you know, then the other thing that we've heard from people, which I found interesting, is that people had heard about the first open enrollment period, but they was so nervous about the cost that they didn't reach out. They just didn't feel like they could go through that stressful situation and try to even deal with it. So they just went without health insurance, because what we've seen this past year, a lot of people's been laid off, they've lost their insurance, and they've never had to shop for ACA insurance before. So they don't know how it works. They don't know where to turn. So it's really good that they work with us because we're able to explain to them how the program works. And then the big thing that what I've noticed is when people learn about the financial help available through the ACA, that makes a huge difference to them. I mean, people don't realize that in New Hampshire, 7 in 10 people qualify for a monthly subsidy that helps pay for their insurance plan. And then a lot of people don't realize too, right now, 4 in 10 people can get a plan for $50 or less. So when you let people know that there is some financial help available with an ACA compliant plan, it really makes a difference. So I hope that we can get that word out there and that people learn about the ACA and that it is an option to be able to get them affordable coverage. And then they just work with an assister in their area if they need to. You know, the state of New Hampshire has federally qualified health centers that have assisters located in most of those health centers. They're called CACs, Certified Application Counselors. And then, of course, they can work with our program at New Hampshire Navigators. So we are in Monday through Friday from 8 a.m. to 7 p.m. And if somebody would like to work with one of our folks, or if they just have some questions, they can reach us at 603-931-3858 or visit us online at acanavigator.com. And, you know, like I said, we're glad to help people through this process and make sure they get all their questions answered and they can get signed up for a plan that's going to be best for them and their families. So thanks again for having me today. I appreciate it.
Thanks very much, Jeremy. I have a question for you, and I think we will post on our website also how to reach you as well as how to reach the insurance department so that people have those links. But what happens if you have somebody who comes in who qualifies for expanded Medicaid, but do you then help those folks as well, or do you direct them somewhere else?
No, so I'm glad you brought that up because that's a big part of what we do. In fact, I would say almost probably half of everybody that we meet with and talk to, they qualify for the state's expanded Medicaid program, and that provides them really great coverage. And we can do the application for them right over the phone without them ever having to go anywhere or go into an office. So that's been a great part of the ACA that really gives really great coverage to a lot of folks.
Thanks. And I'm sure what you've seen and what Tiffany can attest to is that over the last year, as so many people have been out of work, that we've seen the numbers of people on the expanded Medicaid plan go up. So it's been a really important piece.
Our numbers this year versus last year, as far as the number of Medicaid applications we've done, has definitely increased. We've seen a big difference this year.
Great. Thank you.
You're welcome.
Thank you, Jeremy. We're now going to hear from a few providers about what they have seen with the ACA's impact on their patients. We're going to start up north with Ed Shanshala from Amanuset Community Health Services.
Thank you, Peter. And on behalf of our patient predominant board, our over 100 staff and 10,000 patients, I do want to thank Senator Shaheen and her staff for the efforts they've put forth, both in policy and budgets, to invest in the patients we serve, our friends, family, and neighbors, not the least of which is the Patient Protection Affordable Care Act that has been a fairly circuitous path moving forward. And we keep seeing the value of that investment in the residents of New Hampshire. I do want to thank Tiffany we have exceptional relationships with the New Hampshire Insurance Department, and it's one of the things I enjoy about working with DHHS. And I want to echo Jeremy's words on the CACs. We have patient navigators in our sites, and they are certified assisters. So that amplifies and extends Jeremy and his staff's ability to help patients navigate the marketplace, whether it's a commercial product or it's expanded Medicaid. So we really appreciate that collaborative effort. There were two brief stories I wanted to share with you. Senator Shaheen may remember 4 or 5 years ago in Berlin with Senator Hass and Representative Congresswoman Custer. I shared a story of a woman who's an entrepreneur in RN who was able to secure insurance through the marketplace, and in the process of that was able to get the diagnostic work done with mammography and others, and entered into is what was the patient referred to as oncological journey along breast cancer, and got the care necessary, and resulted in a complete pathologic response. Yet as time proceeded, the cancer did reoccur, and the access to the marketplace continues to enable this person to get the insurance they need to continue to get the care. The individual actually is an independent consultant in RN by education, project management, and actually works for another state hospital, standing up their registry for COVID vaccinations and products like that. So that's just emblematic of what we see in New Hampshire. And then if I put my CEO hat on, and some of the challenges we've had as an employer of fewer than 100 staff at times, the commercial insurers, we could no longer get an affordable product at any price. They just wouldn't bid on us anymore. We were self-insured for a few years, which is, anybody who knows the insurance market, I'm sure Tiffany's going to cringe that with fewer than 100 employees, self-insured is a great economic risk. So in the recent past, we were able to move to an individual coverage health reimbursement account. So it was fiduciarily prudent for the organization, took the financial risk out of self-insurance. And it actually gave, as Tiffany stated, our employees access to 3 different insurance companies that had a variety of plans that could meet their needs if they're looking for a single plus one, a family plan. And it gave them more choice. So the ICHRA was significant from the employer's perspective. So those 2 areas have been very important for us, in able to continue to provide primary preventive health care to roughly 1 in 3 in our community. There's 31,026 towns. We have 6 care delivery sites. We care for 1 in 3 of our friends, family, and neighbors. And when I look at the monies that people get through the marketplace as a taxpayer, I'm pleased to see that I get to co-invest in my community so they have access to healthcare. And I see that as a taxpayer, as a co-investment. I like my friends and family, neighbors to be healthy. I like my bridges to stay up when I drive over top of them. So when I see tax dollars, I see this as a wise investment into the health and wellness of a nation. I can't think of any better place to put my tax dollars. So thank you. I appreciate it. And as always, if there's anything we can do, we always will.
Well, thanks very much, Ed. And as you point out, it is a good investment to ensure that all of our friends and neighbors are able to get health coverage, because especially we have seen during this pandemic, if my neighbor is not protected from the coronavirus, then I'm not protected. And that's what we've seen in communities with community spread. So it's a really dramatic reminder of just how interconnected everyone's healthcare is and how important it is to ensure that everybody who needs it can get that care at an affordable cost. And thank you to you and all of the community health centers in New Hampshire for the great work that you do, and for the story about the woman with breast cancer. I do remember that story very well. And it's an important reminder that when we talk about statistics and who gets helped under the Affordable Care Act, it's about real people and their families and the difference that it makes for their families. And I'm pleased to be able to tell you that in the COVID relief package, there is funding for our community health centers. So I think it's the amount that we have heard that you all need in order to continue to operate through this pandemic. So hopefully that will get done and you'll be able to get the continued help. There's also help for federally qualified lookalike. So that again is helpful to New Hampshire has one of those centers, and we need to make sure that they also get the help they need. So thanks very much, and look forward to continuing to work with you.
Thank you, Ed. And now we will go to the southern part of our state and hear from Dr. Marie Ramos from Gatehouse.
Hello, good morning, Senator Shaheen. It's nice to see you again. Thank you for convening all of us today. I wanted to speak on behalf of Gatehouse Treatment Center as medical director there, taking care of those who are suffering with substance use disorder in an integrated primary care fashion. But as you know as well, I have been a primary care family physician for almost a dozen years, delivering babies, working in rural parts of the country, doing community care, and taking care of our most underserved. Particularly in Nashua, New Hampshire, taking care of our most marginalized communities. And I want to thank you so much for advocating for this ACA continuation and to have the open enrollment. It has been integral for community health centers, as you heard from my colleague, but also in serving our most vulnerable, those who have mental health conditions and those who are suffering from substance use disorder. I'm concerned as a family doctor that even for those who have survived COVID, of the unintended consequences of that illness for them. And if we don't have the ACA, those pre-existing conditions could literally be their detriment, both financially and from a wellness standpoint. As a physician advocate in the state, I've been working very closely with State Health Assessment and Improvement Plan Advisory Council. And as the president of the New Hampshire Academy of Family Physicians, we have been advocating tirelessly to make sure that all of our patients, especially those who are in the front line, who cannot work from home, those that are in the homes of our patients, cleaning the hospitals, taking care of our COVID patients, are protected as well. The other thing I want to add is with the ACA, we know that we are able to focus on value-based primary care. And we know that when we focus on primary care and prevention, then we can save not only lives, but we can also save our system from a burden of unnecessary healthcare utilization. And in a time when everyone is looking for ways to be creative and looking for opportunities to help improve our existing conditions as a system, this focus on primary care and making sure that our community members are taken care of and have a medical home is of the utmost importance. The other thing that the ACA and this opportunity provides is a way for my clinician colleagues to continue the work that they've done. The American Academy of Family Physicians during the peak of the COVID crisis found that almost half of family doctors around the country were at risk of closing down their shops. And we know that our rural health care centers, our federally qualified health centers, and our independent practices, that is the bread and butter, the heartbeat of taking care of our patients, our neighbors and loved ones, with the safety and for the opportunities in reimbursement for my physician colleagues and my primary care and other specialty colleagues. they can keep their offices open and continue to deliver excellent care for our patients. I'd like to continue to challenge to take another look in our reboot of our healthcare system. How can we bolster and improve these very important models for community health centers as well, to improve and incentivize community health centers and rural health centers to continue to deliver value-based care and to be supported in that measure. And lastly, one thing that the ACA has shown and that this COVID pandemic has shown is that when we are put to the test as a community, we can rally as a community together to help one another. I'm so proud of my fellow community members here in the state of New Hampshire for coming together in so many different ways, both from a hospital standpoint, insurance standpoint, but also on a community level. I've been very honored to work with HealthCareVoicesNewHampshire.org, which is a campaign of a diverse spectrum of healthcare workers across the state who's committed to deliver the importance and message of getting vaccinated and having safe practices for the COVID-19 pandemic. And I'm also very proud to have started the Lighthouse New Hampshire, which is a Facebook page for our Black and Brown community members in the state, where they can get information that is respected and that is informative for them. So we'll be sure to make sure that they have this link so that they can get access to insurance, maybe for the first time ever. And I want to thank you for continuing to advocate for all of us. I extend deepest gratitude to you and your team, and I ask that you continue to be well.
Thanks very much, Marie. It's really, I really appreciate your pointing out the cooperative effort that has made such a difference here. You've seen that, you saw that in the prior years around how we address substance use disorders and the fact that it's when the community comes together that we make progress. And we're seeing that now. And we got some very good news today with the announcement that Johnson & Johnson is already producing its vaccine, going to start sending it out tomorrow. And hopefully that gives an additional opportunity for people to get vaccinated. And because it's only one dose and you're done, and it doesn't need extremely cold temperatures, hopefully that will be even more helpful as we try and reach some of the underserved communities who have not gotten help when they needed it.
Thank you.
Thank you, Dr. Ramos. We're now going to turn to Lisa Bodwin from Able New Hampshire. She's going to talk about the ACA's impact to the, both the disability community and then her own personal story with the ACA.
Thank you, Peter. And thank you, Senator Shaheen, and everyone for welcoming me to join you here today. Your exceptional championing for protecting the Affordable Care Act, Medicaid Expansion, and those of us with pre-existing conditions has been remarkable. In my professional work, I like to say each of us is either an accident, a decade, or a birth away from being a part of the disability community. This is the field I work in. All people with disabilities have pre-existing conditions. And in New Hampshire, this represents 165,000 Granite staters with disabilities. Most folks don't realize that most people with disabilities do not qualify for Medicaid or Medicare. So prior to the ACA, health insurance companies, I know you all know this, could legally discriminate against people with pre-existing conditions. And in New Hampshire, that was thousands of people with disabilities. So let's hope the Supreme Court does the equitable thing. Prior to the ACA, people with disabilities feared leaving bad jobs because they knew how hard it was to access adequate health insurance. Another overlooked reality is that people with disabilities experience the largest employment gap in our nation. And they also are the people living near or in poverty at the highest rates. So obtaining insurance prior to the ACA was extremely difficult, which, as we all know, creates a negative downward cycle. Another critical component of the ACA's was Medicaid expansion, which most people don't realize increased rates of employment for people with disabilities. It went from about 41 to 47% across our country. So let's hope that this open enrollment period may actually have the secondary positive effect of paving a more reassuring path to employment for Granite staters with disabilities.
Lisa, can you talk about why that's the case, why that helped the numbers of people getting employed go up?
Because there are very strict income and asset limits in disability determination for 100% government-sponsored support. And you can't get a job and even work part-time because you would be outside of the Medicaid limits. So Medicaid expansion was critical to opening up that income limit. So that you're going to go to 400% is incredible. That's very exciting.
Well, we have to get it done, but
yes, yes. So I'm not only a disability professional and a parent, but the ACA has become very personal to me. I've always worked, yet I didn't have healthcare until the ACA, and thank goodness for it. About 26 months ago, a distracted driver struck and nearly killed me, leaving me with 3 catastrophically destroyed limbs and in need of multiple surgeries. I didn't walk for 9 months in 2019 while my bones healed after 6 surgeries. I'm now bionic and light up the airports when I go through, should I ever get to go through an airport again once COVID dies down and we're all vaccinated. In July of 2020, I had to relearn to walk for a second time after my 8th and what will hopefully have been my final surgery. So through no fault of my own, I'm now a person who has a physical disability and I have a pre-existing condition called neuropathy. The ACA is how I've been able to access the ongoing medical care and physical rehabilitation that I still need 26 months later. I still attend physical therapy 3 times a week. So we've all heard that poverty is both a cause and a consequence of disability. It's the #1 reason why people file for bankruptcy in our nation, right? My medical bills neared $1 million. My sons were very traumatized watching me having to rebuild myself. And I just can't imagine how much worse it would have been for us as a family if we had lost our home in the process. So I'm very grateful, Senator Shaheen. Your tireless commitment to enacting, protecting, and now improving the ACA is just touches me personally now, not just professionally. The policy fights you wage, win, and continue working on are still saving people's lives, their homes, and their livelihoods. So thank you. Thanks a million.
thanks very much, Lisa, and thanks for telling your story. And, you know, because you were covered, you have been able to keep your house, you have been able to go back to work. And that's exactly what we want for everybody. And I would just argue that while I've been fortunate enough to be able to do work in Washington to support the Affordable Care Act and improving it, it's really been the voices of you, all of the people on this call, and people across the country who saved the Affordable Care Act. In 2017, when there was an effort to overturn it, it was people all over speaking out and telling those kinds of stories that I think persuaded everyone who voted for it that we needed to keep the Affordable Care Act. So thank you for everything that you do, and we will just keep working to try and improve it, make it better, allow it to cover more people, and hopefully that helps as we get through this pandemic. So thanks very much.
Thank you, Lisa. And now we're going to hear from Pepper Nepo-Mead with her family story of the Affordable Care Act.
Hey guys, my name is Pepper. Thank you all so much for allowing me to be a part of this. This is a very impressive group, and I've really been enjoying listening and very grateful. So I am a barber, and now I'm a stay-at-home mom, but I was a barber for a really long time. And my husband works in a small landscaping company that he's been with since he was 16. And neither one of us had access to insurance because there was only 3-4 employees at a time. So we were young and didn't worry about it. So we just didn't have insurance. And then I started to have some health issues. So I started to reach out, and I could not find a single company that would take me with pre-existing conditions. And then I'd say about 6 months later, I reached out again and I found one that would take me. And for me alone, I think they wanted $900 a month. And working as a barber, that is just not feasible. So, time kind of chugged along. I just didn't have health insurance, and I ended up very sick, and I was in the hospital for 3 days, and the bill was just insane. And I think it was like a 750 credit score. And with all the bills, it went down to 550. And it is insane that it is still an issue for me. I am still struggling. I still have that background that is hard for me to move forward from, which is frustrating. When you have a medical bill, it's not just one hospital. Hey, here, make a payment. There's 6 different people that each want money, that each want a minimum of $200 of a payment. And that's just not feasible. So after I got out and started to look again, because my health still just wasn't awesome, I found out about the Affordable Care Act, started getting educated about it, and was able to get insurance for a ridiculously low amount compared to what it was. It was like, when they told me, I was like, I'm sorry, I don't think this is right. You made a mistake. And it wasn't. It was awesome. And I had health insurance, and I was able to get care that I needed in a time where I really needed it. So I am just incredibly grateful for everything that the ACA has done for me and so many people like me. This is a story that has happened to many people. Lisa that just spoke it's just insane how much this has affected so many people. So thank you so much, Senator Shaheen, for all the backing that you've put into it, and hopefully we'll continue to put and make it better. So thank you so much.
Well, thanks very much, Pepper. Thanks for telling your story and for your continuing support for the Affordable Care Act. I think one of the really important things that we can all do is to share with those people we know the fact that there is now this special open enrollment period. So those people who may have been shut out, whatever reason, should understand that not only is the enrollment open again, but as Jeremy said so well, there are subsidies available and affordable plans. What is it, Jeremy? 4 in 10 can get a plan for $50 a month.
Yeah, that's correct.
So
it's amazing.
It is amazing. And as you point out, a very different situation from what it was before the Affordable Care Act.
Very different.
Thank you.
Well, thank you so much, Pepper. And last but not least, we're going to hear from Sandra Rice-Hawkins from Covering New Hampshire.
Great, thank you for having me. I am happy to be here today on behalf of Covering New Hampshire, which is a project of Granite State Progress Education Fund and the New Hampshire Healthcare Coalition. And our role in special enrollment, open enrollment periods the last several years has been to help bolster public education and publicity, especially in the face of some of the cuts that had been enacted by the previous administration. And I would say we are very, very excited for this special enrollment period. Thank you, Senator Shaheen, for all you did to help advocate for it. Last spring when COVID hit, our organization teamed up with the New Hampshire Insurance Department and the New Hampshire Navigator to do a series of public education sessions informing people of what their healthcare options were. We talked about if you had just recently transitioned from employer-based healthcare, if you had COBRA options, if you qualified for at that time for limited special enrollment, if you have a loss of healthcare coverage, you could enroll in the ACA, or if you might qualify for Medicaid expansion. And those programs were great, but I have to say it was incredibly disheartening to hear stories from individuals who hadn't had health insurance before, who didn't qualify for Medicaid expansion and who were locked out of accessing the Affordable Care Act because they did not have a qualifying life circumstance. And I was just going back this weekend through some of the individuals.
Sandra, excuse me, can you just explain what that qualifying life circumstance is so that people
Sure.
who may not be familiar understand what the difference is between that and this open enrollment period?
Absolutely. So we have an open enrollment period every fall that is open to everyone in the nation. But throughout the year, if you have a qualifying life circumstance, like you have a loss employer-based coverage, you a birth or adoption of a child, some other kind of major life situation, you do qualify for a limited special enrollment period at that time. But that has a time limit, 60 days. And if you miss that window or aren't aware of that window, you lose that option. That's also true for COBRA. If you have health insurance through your employer and you have that COBRA option afterwards, you may not realize it. Or if you had a loss in income, you might be a little bit nervous to sign up for something because usually in that circumstance, most employees are paying the employer and the employee portion. So we had stories of individuals who came to us who'd had none of those qualifying life circumstances and who really needed a special enrollment period. And I know we had a chance to speak with you, Senator, last April, and we shared a couple of those stories we had of people who really needed open enrollment to open back up last spring. They were very nervous about not having health insurance during a public health pandemic. And I am very glad that some of those individuals were then able to sign up during the open enrollment period in the fall. But we know that there are a lot of families in transition right now. And this special enrollment period that we have from February 15th to May 15th really gives another option for families who may have had some transition in the last couple of months, who, as Jeremy said, may have been nervous in the fall or not known about that open enrollment period, to now get that health coverage that they need. We are also encouraging individuals who may have COBRA'd their coverage last year, if they did have a loss of employment, to look again at the Affordable Care Act, because there may be a better plan that's more affordable for you. And we know a lot of families made decisions because they thought that their job may come back or because they wanted to stick with what they knew. But there has been so much transition for so many families this past year that this is really a unique opportunity for families to come back, look at the plans, look at the options, and see if there's something that fits their family needs and their budget in a way that is really helpful to them. So we're very glad about that. And Senator, we have to say we are so excited about the legislation you continue to put forward to not only protect but also advance the Affordable Care Act and build off this landmark healthcare law to make sure that we're trying to address every healthcare need that our families are facing. So thank you so much.
Well, thanks very much, Sandra, and for all of the work that you're doing to let people know what's available out there, and the fact that we do have a special enrollment period now and that people can enroll even though they may not have any of those qualifying life experiences. And I should point out, I can't remember if I said this, but the COVID relief package doesn't include all of the provisions of my healthcare bill that I'm introducing today, but it does include an expansion of tax credits that if they're passed, I think would cover about 1.7 million additional people. So that's very good news. Hopefully that will stay in the bill and get passed. And let me just, because we've got a little time left, are there any questions or other comments that this conversation has raised for people that you would like to weigh in again? Can Peter Fies or Peter Clark or I answer any questions about the COVID package? Pepper, I see you have your hand up.
Yes. So you're talking about things being covered and not covered under the COVID relief package. And I know that it's kind of doing the like 2-tier, the reconciliation. So where in that kind of time frame and process are you trying to and not trying to get these things passed?
The House on Friday passed the COVID relief package out of the House on a party line vote. It is now has come to the Senate. We expect the Senate will take it up as early as Wednesday. Correct me if I'm wrong, Peter Fies. And there will be some, I think there will be some changes in the Senate version of the bill. Those are still under discussion. And the hope is to get this done by March 14th, because that's when the current unemployment extension runs out and people who are unemployed are going to be without help if we can't get this done by then. So that, I think, is the time frame we're looking at, and we may see some changes based on what the House passed when it goes through the Senate. So Peter, do you want to add to that?
No, I was just going to say that your the timing is spot on there, and Senator Shaheen's bill includes expansion of premium tax credits, as she said. For the bill would include those changes for 2 years, but we're really trying to work to build on this legislation to try and make some of those changes permanent so that people have long-term premium affordability, and also address some of the deductibility or deductible concerns with cost sharing assistance that are in her legislation as well.
Great. Marie.
Thank you, Senator. I just want to stress again how much economic sense this bill makes. Oftentimes, as taxpayers, it can be difficult to consider getting more out of our paycheck, particularly during this sensitive time in transition. But as both a taxpayer and also a frontline worker, I think it is so integral that we put money into prevention and to keeping people healthy and well if we want to go back to a new normal post-COVID. We cannot function as a society if we're not well. And so if we can shift in any way to go in a place of prevention, of giving people the opportunity to have a say in how they can lead a healthy and well-lit life, they will be more productive. They will have less day out of the office. They will be able to get into the economy and work maybe for the first time, as one of the participants said today. And I can help people as a family doctor be the best forms of themselves. So it really is a win-win. If we're looking for a place from an economic standpoint that makes sense, let's focus on our self-care and help people flourish after this tremendously traumatic time that we've gone through. So thank you again.
Well, thanks very much for that, Dr. Ramos. And Pepper's showing us one of the really important reasons why we need to make these investments, because we have a next generation of Americans and our children who we want to make sure get the preventive care they need and are covered. And one of the things that this COVID relief package will do is, if it's passed with the support for children in it, it will raise about, I think the number is 20 million children out of poverty over the next couple of years. And that would be a significant improvement in this country. The other thing I just wanted to point out to your point is that what we've heard about the COVID relief package, and there's been a lot of debate about the size of it, but we've heard from everyone from Treasury Secretary Janet Yellen to Jay Powell, who's the head of the Federal Reserve, that this kind of investment right now to help those people who have been hurting as the result of the pandemic, to help get us through the pandemic, to help our small businesses be able to get through the next months, is really critical if we expect to get back by the end of this year to anywhere close to the employment that we saw before the pandemic hit, and to get the economy moving again, which is what we need in order to ensure that opportunities are there. So it's not healthcare per se, but it speaks to the importance of ensuring that families have opportunities and support they need, because that's critical to being able to get healthcare.
Definitely, I couldn't say it better. And our health is, we say that 80% of our health actually happens outside of my office. It's where we live, eat, work, and play. And particularly as it relates to a whole generation, with the tremendous changes that have happened, we need to have a foundation where we can make sure that our kids, our teachers, our frontline workers, our families have the resources they need in order to rebound and to build resilience. So again, thank you.
Hi.
Hello.
I think, no, that's okay. He's He's showing us very dramatically why this is important to do.
I'm so sorry. We're a little crazy this morning.
I get it. It's one of the challenges that families are having right now, and particularly women, as all of you know. So many women have left the workforce because of the challenges of trying to work, to do remote learning with their kids, and it's something that we're going to have to address. Ed, I know I saw you had a hand up.
I just wanted to echo Dr. Ramos's emphasis on investing in primary preventive healthcare. When we look at the pandemic, I think it's fair to say that this was a significant existential threat on so many levels, at a community and personal level. And the importance of looking at the adverse childhood experience as a result of this, which is one of the reasons during the opioid epidemic, which is still occurring, and looking at what is often referred to as social determinants of health that were fragile, now being referred to as vital conditions of health. The pandemic has brought those to the surface of just how fragile those are, and how when we invest in these, we develop resilience at an individual level, which is our interest in investing in children to address these adverse experiences. And it also lets us develop resilient American communities at a very hyper-local level of trust. There is a case in the middle of Florida of a highly resilient community in the face of hurricanes that were often forgotten about because the coast got all the attention. And they came together to develop their own form of resilience for that kind of existential threat. So my desire out of this pandemic is we have an opportunity to invest at a hyper-local level, those communities of resilience and trust. I see it as an investment in national economic and also national security. SARS-CoV-2 was an invasion of a foreign entity, viruses are foreign, on sovereign soil. Article 4, Section 4 of the US Constitution. I think we can do better. We've got 360 million Americans that, when brought together and invested, we can do some exceptional work. So I really appreciate what Dr. Ramos has done. I enjoy serving with her on the State Health Improvement Plan Commission. So appreciate what you do to help us help our local communities develop resilience into the future.
Well, thanks very much, Ed, for that reminder. And I see Lisa has a hand up. That's probably the last, will be the last comment before we have to close. But Lisa.
Sure, just a tiny postscript to my story. Last year in 2020, in order to keep staff on at Able New Hampshire, I had to take a pay cut. And that was fine. It was more important to keep staff than anything else. However, this year, my pay was restored and I received the appropriate raise. Nonprofit workers are not out there vacationing in Hawaii. And I have to tell you, my entire pay raise has been eaten up by my increased monthly premiums and going from a $1,000 to a $5,000 deductible. So my household will not benefit at all from my pay being restored and an appropriate pay for my skill set. And that was difficult. That was difficult information to receive from the health insurance agent that I was working with around my plan. And I said, something must be wrong with that. I know that I'm not the only family that has experienced how a pay raise can be entirely eaten up by increased health insurance costs. So I'm extremely personally very, very happy to hear that average working Americans are going to be able to retain more of their money and less, so thank you for this latest piece of legislation.
Well, thanks very much, Lisa. And hopefully the provisions that are in the COVID relief package will stay there. And I know I'm pretty sure you're aware of the Paycheck Protection Program, which is designed to try and help small businesses and nonprofits. When we were having this debate last year with the CARES Act, based on what I heard in New Hampshire, I really fought hard to ensure that nonprofits were included as part of those small businesses, because you provide such important services to the people of this state, and that's true across the country. So there is another round of those PPP dollars that are available for people who may not have received the first round, and for they're available for physician practices, for nonprofits. So I hope all of you are checking to make sure, if you qualify, that you know how to get how to apply for those funds, and feel free to call our office if you need help, because we are here to try and help with that, and to try and do everything we can to ensure that we get through this pandemic and people come out on the other side and are able to continue to work, continue to support their families, and continue to stay in the housing that they have, which is another big issue, as all of you know. So again, I don't know if anybody has, in the 2 minutes that's left, if anybody wants to make a final comment, but let me just thank you all so much for joining us, for the continued work that you do. If you have any thoughts about what I should be looking at through our office, talk to Peter and Peter. They can help make sure that that information gets to me, and as we're having these votes and debating in this next couple of weeks to get this COVID relief package done, I'm going to be doing everything I can to ensure that the help gets to the New Hampshire families that need it. So thank you all.
Thank you, everybody.
Very much.
Thank you.
Keep delivering for us. We appreciate it.